Hi everyone, welcome to my podcast channel Cancer Care. I'm your host, Dr. Murali Subramanian, medical oncologist in Bangalore. As doctors, I strongly feel that the role of a doctor is not only direct patient care but also disease prevention. I feel that one of the most important elements in disease prevention is creating awareness about the disease itself. Doctors should share information to their patient, their caregivers, and all others regarding different diseases. How does a doctor create awareness? It's through community education sessions, one-to-one counseling sessions, or through different media channels. So to fulfill my responsibility, I have created a podcast channel known as Cancer Care, where every week I'll be talking on different cancer topic. So in today's episode, I'll be talking about a very important topic which is very common in women. Yes, it's breast cancer and its treatment. We are getting better at opening up and started talking about difficult subjects, but many of us still hesitate to talk about them or avoid them eventually altogether because we think they don't affect us, especially when it comes to cancer. As per the study, breast cancer is the most common cancer in women. Early diagnosis will help keep the disease under control. Around 30% of breast cancer cases are aggressive, which are rapidly growing tumors. Okay, let's get started. What are the symptoms of breast cancer? A lump observed in the breast or under the arm, swelling or shrinking of the breast, perhaps on one side, discharge of fluid from the nipple, redness or thickening of breast skin, an inverted nipple, a dimpled breast. These are some of the symptoms of breast cancer. So what diagnosis options we have? The doctor discusses a family history, a physical examination of breasts, biopsy, various imaging procedures like mammogram, MRI, ultrasound, PET scan. Women who have a family history of breast cancer are advised to go certain genetic tests or to have regular screening tests. Treatment of breast cancer. Lumpectomy. This is a technique in which surgery is performed and only the cancerous tissue is removed along with a layer of healthy tissue surrounding it. Mastectomy. In this procedure, the complete breast is removed. Sometimes the doctor tries to save the nipple if avoidable. A skin sparing mastectomy is a technique where the surgeon removes the inner breast tissue but keeps the skin intact. Axillary lymph node dissection. During the removal of cancer cells from the breast, a biopsy of the lymph node is mandatory to examine the spread of cancer cells from the breast to the axillary lymph nodes. Therapy. Therapies such as chemotherapy, hormone therapy, etc. are done to eliminate cancer cells. Radiotherapy or radiation therapy. In early stage breast cancer, if it has been diagnosed, then only the cancer cells are administered with radiation therapy. Radiation therapy is sometimes given soon after lumpectomy to prevent resurgence. Before winding up today's podcast episode, I wanted to answer one most frequently asked question, that is, how to prevent breast cancer. Friends, some risk factors such as family history cannot be changed. However, there are lifestyle changes you can make to lower your risk. These are: limit your alcohol intake, do not smoke, control your weight, be physically active, breastfeed, limit dose and duration of hormone replacement therapy, avoid exposure to radiation and environmental pollution. For some people, having cancer and going through the stress it brings can make life isn't worthwhile. Please talk to your doctor right away if you have any unusual signs and symptoms. Thank you for your time. Catch up with you all soon with another episode of this podcast series with another informative topic. Hope this podcast episode on breast cancer is useful to you all. This is me, Dr. Murali Subramanian, signing off.